Back pain is no justification for murder, but it is one piece of information swirling around the background of Luigi Mangione, accused of killing healthcare CEO Brian Thompson.
With the recent killing of United Healthcare CEO Brian Thompson, there's been a lot of talk about the healthcare industry, especially in the United States. And let's be honest, this frustration isn't new. On December 4th, Luigi Mangione was arrested for the premeditated murder of Thompson. Naturally, people are asking, why? What would drive someone to do this? While Mangione hasn't spoken directly, the evidence suggests his actions stemmed from a deep frustration with corporate America and the healthcare system, particularly how health insurance companies operate. Even though Mangione came from a wealthy family, he, like many others, felt the system was failing people, leaving them feeling taken advantage of when they needed care the most. Now, Mangione had first-hand experience with the healthcare system, dealing with a serious spinal condition that caused him a lot of pain. He did end up getting surgery, but as a surgeon, I can tell you, surgery doesn't always fix everything. It is often a last resort after all other non-operative measures have failed. Unfortunately, Mangione's story is far from unique. He was just one of the many struggling with chronic pain, which can be incredibly frustrating. Chronic pain is one of the most common health issues worldwide, affecting up to 20% of the population. And when we talk about chronic pain, back pain is often at the top of the list.
60 million people or so have episodes of back pain in the United States alone.
Chronic pain affects more than just your body. It's also a physical and financial burden. Treatments, surgeries, missed work, and on top of that, the mental health toll is huge. Today we're diving into Luigi Mangione's medical case, focusing on his spinal condition and the challenges of surgical treatment. We'll also explore the difficulties people with chronic pain face in the healthcare system and how these struggles may have contributed to what happened.
Free Luigi, gang. That us. Free Luigi. I'll trade plays. I've been in jail for 5 years. He don't know what it's like yet.
Regardless of your view on this situation, we should take it as a learning opportunity. I'm not justifying Mangione's actions, but people have been frustrated with the healthcare system for a long time. I know because I see it on a daily basis. To prevent situations like this, we need to reflect as a society and ask, what can we do better? From all sides, providers and patients. When police found Mangione, he had a brief manifesto condemning health insurance companies as parasites and a backpack with a Monopoly board game inside. For those who don't fully understand how health insurance works, it is, after all, a business. Here's a quick breakdown. Insurers make money by collecting premiums, monthly payments, from policyholders, you. These premiums fund their operations and medical payouts. If a company brings in more premiums than what it spends in operations and payouts, then it is profitable. The goal is to minimize payouts, meaning insurers aim to pay as little as possible to keep profits high. When you buy insurance, you're paying for coverage, not automatic approval for all treatments. Not automatic approval. Insurance companies often require proof that a treatment is necessary, not elective. For serious procedures like surgery, doctors must show that less invasive treatments have failed or that the procedure is absolutely essential. If a claim is denied, patients can appeal, but the process is often long and complicated.
You could submit an appeal and begin that lengthy process, which on average takes over 180 days, a window in which 47% of respondents said their health condition got worse.
Insurance companies say this helps keep premiums lower for everyone and make sure there's money for expensive conditions like cancer or heart disease. They also argue that by denying unnecessary treatments, they can lower overall healthcare costs and focus on only the treatments people actually need. So that's the basics of health insurance. And as a surgeon, even one from Canada, where we have publicly funded universal health care, it's still a struggle to get patients the care that they need.
I said Luigi been a dog since he put his pampers on. Vagabonds ran out the mouth like a marathon.
I've also personally worked on over 600 insurance assessments where I have reviewed cases to determine the need for specific treatments. And while private insurance companies can sometimes be shady, I can understand that getting people the help they need when they need it also means making sure they really need it. What I mean is that pain is subjective. people rate it drastically differently.
There's this one time I had a patient who told me their pain was an 11 out of 10, and they were sitting there talking just fine. They looked normal.
I often ask patients to rate their pain 1 through 10. 10 to me means you'd pay me $1,000 out of your back pocket right now to amputate that body part with a rusty butter knife. And for others, 10 might just be uncomfortable.
9 out of 10 pain is you being mauled by a bear. If you are not being mauled by a bear, then you do not have 9 out of 10 pain.
So determining whether a surgery is necessary or elective based solely on subjective measures can be really tricky. Just from a purely practical standpoint, there are only so many doctors, and I already work 60 to 80 hours a week. To reduce wait times and save surgeries for those who really need it, sometimes we have to tell patients, you'll be fine, try this first. When Mangione criticized the capitalist healthcare system, saying that doctors respond more urgently to phrases like, I can't work, than just describing pain, well, he's not wrong. Doctors want to know if the pain is actually affecting your ability to function. But let me be clear, that's not an invitation to exaggerate your symptoms just to get surgery. Just as it's irresponsible for insurers to deny necessary care, it's also irresponsible for a patient to exaggerate their condition. Remember that there are only so many doctors and only so much time. The goal of an effective healthcare system is knowing when a condition can be managed versus when it needs direct treatment. Ideally, specialists should work together, communicating with each other and guiding patients to the right care. This is an area where we, as an industry, can improve. There are many options to help a patient's condition depending on its severity. Management includes both conservative and ongoing methods for controlling symptoms and improving function. Things like medication, such as NSAIDs and steroids, physiotherapy, massage therapy, and other alternative therapies, including chiropractic, epidural steroid injections, and even just lifestyle changes. Some of these, depending on your specific plan, can be covered under health insurance too. Definitive treatment, however, can involve interventions like surgery to address the root cause. In Mangione's case, his condition was severe enough to require both. He had spondylolisthesis, a spinal condition, and as you know, the spine is kind of a big deal, bro.
But this is the neck area up here, the thoracic spine over here, that's behind your chest, and then this is the lower back.
The spine is made up of vertebral bodies, which stack on top of each other like building blocks. They're connected by joints that allow movement. Facets along the sides of each vertebrae guide and limit this movement, while discs in between act as shock absorbers.
The discs are a rubbery type material which helps give you cushion in between your vertebral bodies and also contributes to flexibility in your lower back.
He goes on to explain that alongside the vertebral column runs the thecal sac, which is like this long balloon extending from top to bottom.
Now imagine that long balloon filled with fluid, and inside of it is angel hair spaghetti or horsehair.
So there's a lot of nerves around these bones, some parts of which are quite delicate. Spondylolisthesis occurs when the vertebrae actually slips out of alignment.
Big word, basically means that two of the bones in the spine are sort of slipping.
If you've seen my videos, you know that I'm not a fan of chiropractors using the term subluxation to describe spinal misalignment. Orthopedic surgeons often push back on this because it's a vague term with little solid evidence, more of a theoretical concept. Most so-called subluxations are just joint inflammation or dysfunction, not true misalignment. But with spondylolisthesis, we're dealing with actual, real deal structural displacement of the spine. For real. Spondylolisthesis typically happens in the lumbar spine, near where it meets the tailbone. Here's a side-by-side comparison of a normal spine versus an abnormal one.
That creates some disc bulging here and pinching of the thecal sac in this area.
A disc bulge happens when the outer layer, or the annulus, of a spinal disc weakens or tears, letting the gel-like inner material, the nucleus, push out. In the case of spondylolisthesis, this occurs due to the vertebrae slipping. While inflammation can be an issue, it's mainly nerve compression that causes back, leg, and buttock pain. When the cauda equina, a nerve bundle at the end of the spinal cord is compressed, it can lead to weakness, numbness, and sensory changes, especially in the legs. Dr. Armagani also notes that spondylolisthesis causes abnormal movement between the bones, which gets irritated with every movement. This grinding can lead to arthritis, more inflammation, and more pain. In severe cases, it can cause stenosis or narrowing of the spinal canal either centrally or at the sides around individual nerve roots. Spondylolisthesis can be caused by factors like birth defects, wear and tear from osteoarthritis, trauma, or excessive stress on the spine, common in athletes or people with physically demanding jobs. Nerve damage or chronic pain from spondylolisthesis can lead to symptoms like brain fog, cognitive issues, and mental health struggles. Any of these factors could have contributed to Mangione's condition, but it's important to note that he was young, so it likely wasn't a degenerative issue typically seen in older patients. Symptoms vary, ranging from mild to severe, depending on how much the vertebra has slipped. It's easy to see how a spinal injury like this can lead to significant distress. While the full details of Mangione's medical case are unclear, based on what he shared online and through sources close to him, it seems Mangione had been dealing with his spinal condition for years, possibly since childhood. It worsened after a surfing accident in Hawaii in 2022 that destabilized his condition further, causing his back and hips to lock up as a protective muscle reaction. He also developed sciatica, a sharp shooting pain down the leg caused by pressure on the sciatic nerve in the lower back. A week after his accident, he slipped again, causing his right glute to lock up and making it difficult to bear weight. Though the pain eventually eased, his spinal stability was still compromised. The impact of his back pain on his physical, mental, and social life likely deepened his emotional strain, leading to his withdrawal. However, in July 2023, there seemed to be a turning point in his recovery when he underwent surgery, which appeared to have helped. Well, at least temporarily. His X account appears to show an X-ray image, believed to be his, with metal rods and screws inserted into his lower spine.
You see 2 screws that are in that L5 bone, and you see 2 screws that are in the sacrum. Those are the ones that are lower down. There's screws that are going into this bone here, and screws that are going into this bone here.
But as Dr. Gupta points out, we don't know for sure how effective the surgery really was. From a medical standpoint, there is concern in the community about how well the screws were placed. The most common operative treatment for spondylolisthesis is stabilization with rods and screws, or instrumented posterolateral interbody fusion. This usually involves removal of the bone compressing the spinal cord, a decompression, placement of adjustable screws into the arches of each vertebral body, pedicle screw fixation, joining the unstable vertebrae together, fusion, and connection of the screws together, final stabilization. While the topmost screws in Luigi's X-rays were placed appropriately through the pedicles into the vertebral body, the most inferior screws into the sacrum appear to be a bit long, extending beyond the front of the bone into the sacrum. Also, while the degree of displacement of the vertebra was less than 50% of the width of the vertebra, grade 1 or 2 of a possible 4, there is debate about whether or not stabilization should have been performed in situ without moving the bones back into position, as it was with Luigi, or after reduction, where the bones are moved back to their original position before stabilization. Research into this question is ongoing, with no clear winner in which approach is the best. That said, even with the best surgeries, some pain is still to be expected, which Mangione also documents. After spinal procedures, it's normal to experience incisional pain, muscle soreness, inflammation, nerve pain like tingling or sharp pains, and muscle spasms as the body adjusts. Bone pain can also occur on occasion, particularly if other bones were affected. While rare, chronic pain can persist if there are complications, but most of this should improve over time with medication, physical therapy, and rest, usually within weeks to months. Compared to the chronic pain he dealt with for years, the recovery pain was likely a temporary hurdle worth enduring. As I mentioned, chronic pain from conditions like spondylolisthesis isn't just physical. The mental health aspect can often be just as, if not more, debilitating. Dr. Armagani explains this low-key depressing point.
What we do find, though, is that this discomfort is worsened with standing and walking and is improved with either sitting down, laying down, or leaning forward over something.
So, you'll feel most comfortable if you just don't move. Cool. But listen, sometimes when you're injured, you use crutches. Sometimes elderly people use walkers. But as a general rule, it's vital for humans to keep moving. Life equals action. Our bodies are designed to move. So when he says the pain gets better when you don't move, he's kind of stating the obvious. But while avoiding movement might reduce pain, it's no way to live. Being physically inactive can cause your brain to work overtime, unsure how to handle all that excess energy, which can lead to a downward spiral. I totally empathize with these patients, the frustration and desperation to heal. It's like a catch-22. Move and it hurts. Don't and you're stuck. And while conditions like this are not a finality, they can improve. It's hard to see beyond them when you're in the thick of it. News channels were initially discussing whether or not Mangione could potentially use the defense of extreme emotional distress. But as I am making this video, he was officially charged with first-degree murder. That said, it's not hard to imagine that someone with his condition might be mentally drained, given how much chronic pain can disrupt every part of their life. Like many others dealing with similar struggles, Mangione just wanted to feel normal. As Dr. Beth Darnell, Stanford University pain management specialist, explains, about 10% of people have what we call high-impact chronic pain. This means it impacts daily activities from school, work, even basic self-care. These people are more likely to struggle with their mood and have difficulty getting restorative sleep, all of which can worsen the distress and anxiety that naturally come with pain.
If you were to ask how many people who are insured get denied their healthcare claims, there's no math on that, because they will never release those numbers.
And while there's a lot of evidence that people with spinal injuries have much higher rates of depression, anxiety, and PTSD, you might be wondering, can a spinal issue cause a mental health disorder, or are they just linked?
If you were to ask how many were uninsured and die every year, it's approximately 48,000, 4,000 people a month, 130 a day, 5 an hour.
While theoretically, severe compression could, in rare cases, affect the spinal cord and potentially disrupt brain function, most research focuses on how chronic pain impacts lifestyle and how that in turn affects mental health.
She reported him missing to the San Francisco PD on November 18th, and at that time, John, she didn't believe he was a threat to himself or others.
But while they were concerned, they never imagined he'd hurt anyone else. They just wanted to know where he was. So, what went wrong? Maybe the surgery wasn't as successful as he thought. To understand, we need to look at what spinal surgery involves. With spondylolisthesis, the choice to opt for surgery depends on factors like how much the vertebra has slipped, the pain, and its impact on the patient's life. There are also several different surgical options like spinal fusion, decompression, or disc replacement, depending on the severity, the patient's age and activity level, and the surgeon's expertise. Spinal fusion stabilizes the spine by fusing vertebrae, often using screws and rods, like we see in Mangione's x-rays. The success of the procedure depends on many factors, like the patient's overall health, for example, arthritis, smoking, etc., the surgical details, bone graft material, fusion levels, and the biomechanical properties of the fusion itself. Success rates can vary between 65 and 100%. And if it fails, a revision plan should be implemented right away. That's a fair expectation of the medical team. However, let me emphasize that success is multifactorial. Some factors are beyond the patient's control, while others are directly related to lifestyle choices. As I've said many times as a surgeon, surgery should always be a last resort. As a surgeon, I believe that surgery is a last resort, and patients should do everything in their power to support a successful outcome. That's what doctors expect from patients. Help us help you by making healthy lifestyle choices. Back to the main point, the several types of spinal surgery. Another of which is decompression or laminectomy, which removes part of the vertebrae to relieve pressure on the nerves. It's successful approximately 3/4 of the time and is often used in combination with fusion. Another option is posterior lumbar interbody fusion, where a disc is removed and replaced with a graft to promote fusion, done through the back. Then there's anterior lumbar interbody fusion, which is similar but accessed through the front to avoid disrupting muscles in the back. There are a few other techniques, but the key takeaway is that spinal surgery is complex and depends on many factors for success. While spinal surgery is usually effective, it's not a guaranteed fix. Studies show that 15 to 20% of patients might not get full relief after surgery. For someone like Mangione, who dealt with chronic pain for years before opting for surgery, the psychological toll of not knowing whether the procedure would work likely added to his stress. Even if the surgery goes as planned, again, many factors can impact the outcome, like post-surgical complications, such as infections, improper healing, residual pain from nerve damage, muscle imbalances, or scar tissue formation, as well as psychological factors like depression, anxiety, or unrealistic expectations. These all influence how pain and recovery are perceived. Inadequate rehabilitation after the surgery can also lead to weaknesses or improper function in the spine and supporting muscles. To improve surgery success, active rehab is key. While it may hurt at first, since the overall goal of healthcare is to not experience pain, working through the discomfort helps recovery in the long run. Patients need to actively participate in their healing, starting with gentle movement and walking after surgery. Strengthening the core and lower back with exercises like planks, bridges, and pelvic tilts can help to stabilize the spine. Flexibility exercises, stretching, and posture training are also important to avoid tightness and strain. Mindfulness and breathing exercises can reduce perception of pain and stress. While I can't speak to Mangione's exact fitness routine before or after surgery, he appeared to be very active. You can see it from his physique. His online posts show he enjoyed outdoor activities like hiking and even took up yoga after his accident, being cautious with certain positions. Despite his spinal condition, he did what he could, although he was used to more intense training like weightlifting and martial arts. He also mentioned that being sedentary was the worst part of chronic pain. Mangione shared encouraging messages with others in similar situations and read self-help literature, so it's reasonable to assume he'd be open to actively participating in his rehab. That said, rehab is painful. I just put out a reel about this on Instagram about people's expectations for rehab. Go check it out. The thing is, most people don't realize how painful it's going to be. It's unavoidable, both pre-surgery and post-surgery. In an article for People magazine, Dr. Uzuma Samadani pointed out that many insurance companies require 6 to 12 weeks of physical therapy before approving surgery. If you know you need surgery and insurance is dragging its feet, that's frustrating. But as we've discussed, surgery is a big decision. When Dr. Samadani refers to pre-surgery physio as mandatory torture imposed by insurance companies, it's not quite that simple. People like Mangione often get frustrated when doctors dismiss their pain, feeling like they're not being taken seriously. Mangione even advised others to keep seeing surgeons until they get the help they need, arguing that the idea of nobody will operate until I'm 40 is nonsense. While I agree that age limits for surgery are a bit ridiculous, I want to stress again that surgery should always be a last resort. This makes sense because surgeons know the expected lifespan of the surgeries we perform. We know what the expected benefits, risks, and complications are for each surgery, and we know that performing some surgeries too early in life may set patients up for worse problems later in life.
Because health is one of the most important things to being human.
The inconvenient truth is that while healthcare should be easily accessible and affordable, if not free, doctors are overwhelmed. I say this as a surgeon. You should see my freaking wait times, bro. But there are just more patients than doctors. And a lot of doctors' time is spent on preventable issues.
If you are not in good health, then that basically closes the door to every other thing that you would like to do in life.
Yes. There are accidents or severe conditions, but many health issues, including chronic pain, are often multifaceted and preventable. Health is not just fitness, it's a lifestyle.
you can get rid of one theory. Americans don't consume more healthcare than people in these other countries. We don't go to the doctor more than the Germans or the Japanese. In fact, we go to the doctor less.
While it might feel like there's an oppressive system that reinforces unhealthy living, people actually have way more control than they think. And it begins with your daily habits. If we don't value our health, how can you expect anyone else to? Health insurance companies are often profit-driven enterprises, which can be seen as just another branch of systemic greed.
United Health Group owns the country's largest insurer, the country's largest claims processor, the country's third largest pharmacy benefit manager, a huge pharmacy chain.
Like any business, they want to make money, and their shareholders rely on them doing so.
It is the largest employer of physicians nationwide, or controller, with at least 90,000 physicians, as you just testified. That's about 1 out of every 10 doctors in the country.
United Health Group, Cigna, Anthem, and Humana are some of the largest companies in the healthcare sector.
As far as the physicians are concerned, we employ just under 10,000,
Well,
and
as
the
I
rest
said,
are
I think
affiliated.
you have control over about 90,000.
I would say not controlled. They choose to work with us.
Okay.
Their stocks are often bought by regular people through brokerage accounts, 401ks, IRAs, or mutual funds that include healthcare stocks. So many everyday people are literally buying into it.
Because United Health has bought up every link in the healthcare chain, you are now in a position to jack up prices, squeeze competitors, hide revenues, and pressure doctors to put profits ahead of patients.
If these companies profit by denying coverage, well, regular people, patients, are benefiting from it.
United Health is a monopoly on steroids.
If our societal values prioritize money over health, and we show that with our daily decisions, then it's no surprise that this is happening, even within an institution that's meant to be ethical.
With this web of subsidiaries, United Health is well positioned to rake in more taxpayer money by using a practice called upcoding to make enrollees look sicker.
Remember, society and its institutions are made of people. And unfortunately, the same things that often drive us in our daily lives often affect them too.
That is, noticing that a patient has a cane and adding a diagnosis of vascular disease to the medical chart, even if there's no clinical basis for the diagnosis and no treatment planned.
We need to understand the role our actions play in perpetuating these systems. We can't be complacent or negligent about our own health and expect them to care about it more than we do. Healthcare is about empowering individuals and preventing pain. While it's easy to point fingers at a broken system, we all need to do our part to change it. Healthcare professionals must be compassionate with patients' experiences, but we also need to place more emphasis on educating them to address the root causes, not just the symptoms. After all, prevention is the best medicine. If you learned anything in this video, then all I would ask is that you leave a comment and give it a big thumbs up to feed the algorithm. This will help us to grow the channel so that we can create more engaging videos in the future. And if you think that this message is worthwhile, consider sharing the video as well. If you didn't like the video, that's okay. Be sure to let me know why in the comment section down below. We are working towards a goal of 1 million subs, and we would love to have you with us when we get there. Don't forget to follow my gym, Human 2.0 Fitness, for free right here on YouTube, where we post content that helps you move better and prevent injury. Or its sister channel, Human at Home, where we show you how to be healthy in the space where you live. Otherwise, as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one, bro.